This is a question that we get all the time. When should my child first see the orthodontist? So the short answer is around about 7. And no, that doesn't mean that we're going to do the braces at age 7. So let me explain. So why age 7? By this age, most kids have usually got a mix of their baby teeth and their adult teeth. And that's the perfect time for a specialist orthodontist to check them. What teeth have come through, what teeth haven't come through, how the jaws are growing, whether everything is tracking as it should. It's like giving their smile a bit of a head start. We can see what's going to happen in the future, so we can give you some guidance. So often at that appointment, we're simply meeting the child. We're looking to build a bit of a relationship, because sometimes we see them once a year for a friendly growth check and no treatment's actually needed. We're just watching. Other times we're just keeping an eye on things and seeing how they develop. So it's pretty easy, stress-free and kid-friendly. So what are the signs you may need to get involved with some interceptive treatment? So what things that we're keeping an eye out for? Crowding, and a lot of it. And usually we can see this with the lower incisors at 7 to 8 years of age, sometimes the upper incisors too. Baby teeth falling out too early or too late, as we talked about. Front teeth sticking out, underbites, overbites, cross bites, thumb or finger sucking, trouble chewing, mouth breathing, big differences between upper and lower jaw sizes this way and that way and up and down. If we see these spots early, that we're going, right, this is something we need to focus on, and we're going to guide your growth before the teen years start. So why early treatment matters? Kids' jaws are a little bit softer, so they're still growing, which means the treatment sometimes goes a little bit faster and is more comfortable and more effective. This is especially the case if we're doing palatal expansion, widening the upper jaw. It's far easier before puberty. It creates space by reducing crowding and correcting the cross bites. Because once the upper jaw midline has started to fuse, the suture, the expansion becomes much harder and sometimes requiring extractions later on, and even in really difficult cases, surgery. So early treatment can also reduce the need for braces or aligners of the teeth, potentially reducing the overall cost. It can help with speech, boost confidence, and who doesn't like to have a confident smile, especially a shiny, bright smile for the kids. So what if your child doesn't need early treatment? Then what do we do? Well, great. We simply monitor once a year on average until they're teenagers, and then all the adult teeth are through, and then we go, right, this is the right time for us to do the treatment. So if we're doing the monitoring, best of all, there's no fees for that. So we just want to make sure you're comfortable. So most teens do end up doing braces or aligners. Around about 10 is the starting point, but on average about 12 to 14. And every child is different. And that's why it's so helpful to have the early checks, because you just never know when your child is going to be the right age. So just a couple of things to summarize. Basically, between about 7 and 10 is when we do the interceptive treatment or early orthodontic treatment, and it can make a huge difference. But the key is the personalised timing. And at Beachside Orthodontics, I will assess your child's smile and bite and explain everything clearly and guide you